Hi, my name is Autumn Strecker. My poster is going to be over managing foot complications in the diabetic homeless population. So to start, homelessness remains one of the most significant issues that the United States continues to deal with every single day. Not only do homeless individuals experience financial instability and lack of resources, but homeless individuals also have an increased risk for many chronic health conditions, infectious diseases, substance abuse, and mental health disorders. Individuals who deal with these issues need healthcare services, but because of the lack of finances, most individuals will not seek medical intervention, which in turn can lead to poor health outcomes. Diabetes is just one of the many chronic health conditions that individuals can suffer with, whether it be type 1 or 2, and this requires adequate adherence to the care plan for that specific individual. Inadequate control of blood glucose and lack of insulin can cause serious problems, including vision or loss of vision, nerve pain, kidney injury, heart conditions, and severe foot-related issues, including amputations. Managing diabetic foot ulcers can be very complex and challenging for patients, and even more so for those who are homeless due to the lack of proper resources, finances, knowledge on how to take care of these issues. So some background and significance with this issue. So major complications of diabetes are foot complications, and that includes ulcerations, infections, and amputations. And these complications just increase dramatically when an individual is homeless because adequate foot care practices are more likely not to be performed. So according to the World Health Organization, it is estimated that over 15% of those who are diagnosed with diabetes, whether it be type 1 or 2, will develop a foot ulcer at some point in their lifetime. Another study conducted by the Journal of Diabetes and its Complications found that over half the patients who went to the hospital for proper foot care failed to receive adequate follow-up wound care. There are many factors that play a role in the development of a diabetic foot ulcer in the homeless population, and these risk factors can include closed versus open-toed shoes, proper foot examination techniques, proper nutrition, adequate monitoring of blood glucose levels, and follow-up care. Other factors that contribute to the development of a foot ulcer include poor foot hygiene, long periods of standing and walking, and wet socks and shoes, as this can lead to skin breakdown and formation of an ulcer. It is extremely important for the diabetic homeless population to receive adequate care when it comes to preventing and treating foot ulcers. A considerable barrier to proper foot care is the lack of financial stability to pay for the services and resources needed to maintain their diabetes. Many people struggle to come with things like a glucometer to check their blood sugars with, testing strips, syringes, and probably the biggest struggle, insulin. So coming up with ways to provide these resources to this population could highly decrease the rate of ulcers and infections. So my PICO question was, in the diabetic homeless population, how would a proper knowledge on adequate foot care practices compared to limited knowledge affect the rate of ulcers and amputations in this population? So when it comes to the literature review, many of the research articles that were retrieved primarily discussed either foot problems in the homeless population or foot problems among diabetics. There were very few articles that discussed these topics together. After reviewing multiple articles and the data that was obtained, the following were identified as significant risks for development of diabetic foot ulcers. And these included peripheral neuropathy with loss of protective sensation, peripheral vascular disease, foot deformity, previous foot ulcerations, evidence of increased pressure, and this could include erythema and hemorrhage under a callus, and then a history of ulcers or amputations. It is estimated that over 700,000 individuals across the U.S. are homeless, and these individuals have a significant increase in mortality, morbidity, and hospitalization rates. When it comes to the rate of diabetes in the homeless population, in one study, the prevalence rate suggested from 6.2 to 23%. It was also found that 41% of the homeless patients who struggle with diabetes had difficulty walking, around 42% lost sensitivity to their feet, Reduced mobility was at 43%, and finally, 17% experienced some form of lower limb amputation. Let's see. A huge aspect of preventing diabetic foot ulcers is proper foot examination and awareness. It's not only the sole purpose of the healthcare professional to examine the patient's feet, but also the responsibility of the patient themselves. And because of this, education regarding foot care and examination are crucial. According to SAID 2010, individuals are more likely to follow a treatment plan when they have acquired the proper knowledge about their medical condition. A majority of individuals, especially homeless individuals, lack the proper knowledge and don't know the comorbidities that are associated with diabetes. And because of this, they do not pay proper attention to their feet. Associated comorbidities and risk factors to developing a foot ulcer includes hypertension, hyperlipidemia, alcohol and tobacco use, obesity, and elevated hemoglobin A1C levels. Not only are there those risk factors to diabetes specifically, but there are also certain risk factors to being homeless. These include mobility and function related to individuals walking more than 5 miles a day, foot hygiene, including not washing their feet daily and wearing wet socks, and footwear, as homeless individuals often have improperly fitting shoes, whether these be too big or too small. And then, of course, access to foot care health, because individuals cannot afford doctor's appointments or hospital visits. Many of the articles that were acquired mentioned a lot of individuals lacking proper knowledge, like I said before. In one article, it was discovered and stated that accurate understanding of one's disease in relation to the development of a foot ulcer dramatically increased foot self-care practices in these patients by directly addressing their concerns and misconceptions. While reading and reviewing the literature related to this topic, it was found that there were very few tests that were actually conducted among the studies to assess a patient's foot sensation. Some of the tests that were included were the Michigan Neuropathy Sensitivity Questionnaire, the Patient Interpretation of Neuropathy, and the 10G Semmes-Weinstein monofilament set. If any sensory loss was observed during these evaluations of the individuals, this could put the individual at even greater risk for developing a foot ulcer and injury. Not only should these tests be performed to study sensory loss, but the skin also needs to be assessed for any decreased integrity, especially between the toes, as homeless individuals are often moistened there. It is apparent from the literature required that homeless diabetics are at great risk for developing a diabetic foot ulcer, and it is important as healthcare professionals to attempt to try to help these individuals to the best of our knowledge. So for the QSN competency, the quality and safety education for nurses, and it is an initiative that began in 2005 that focuses on preparing new graduate and future nurses to have the knowledge, skills, and attitudes necessary to improve the safety and quality aspects of the healthcare system that they will be working in. The competency that works directly with the topic of managing foot complications in this population is evidence-based practice. Many of the practices that have proven to be effective in managing ulcers include proper observation techniques, correctly fitting shoes, dry socks, proper diet and blood glucose management, and exercise. Again, a huge problem to this population in developing foot ulcers is ill-fitting shoes. In one study by Jolly Moore in 2017, it was found that more than 40% of men who are homeless wear ill-fitting shoes, and that directly correlates with the ulcer formation, as walking is their only form of transportation. Proper foot examination techniques are a crucial and integral part of managing diabetes, especially for the homeless. However, it is known and has been proven that those who are homeless lack this knowledge and resources to receive the proper foot examination from licensed professionals. So it is vital for us and this population to know the correct techniques and when to get help if necessary. So recommendations for future research. Future research should observe the effects of established individualized foot care practices across many different populations to examine if there's a reduction on the prevalence of diabetic foot ulcerations just together or in just specific populations. Not only could this intervention expand an individual's knowledge on self-care practices, but could also educate people on other complications that can arise from having diabetes. Future research should also study and assess foot care issues over different populations in general to examine if other groups of individuals experienced an increased rate of foot-related problems and how this can contribute to the formation of a diabetic foot ulcer. According to Toe, Brothers, and Zeus, comparative studies of homeless and housed individuals could yield more epidemiologic data and identify potential areas for intervention. Future qualitative studies could examine what the different barriers are to maintain adequate foot care and accessing these services. Some interventions that could happen with these studies include providing essential items necessary for proper foot health, including dry, clean socks, properly fitting shoes, and even education on why these interventions are important. Because again, the homeless population lacks this knowledge. So in conclusion, it has been researched and found that foot conditions among the homeless population are very common. The rates continue to increase when an individual is diabetic, among also with being homeless. It was found in the research that the frequency at which diabetic patients take care of their feet is highly inadequate, even more so in the homeless population. There are many barriers that contribute to the lack of foot care in the population, including lack of access to high-quality healthcare, depression and other mental health illnesses, dietary limitations, lack of motivation, difficulty in maintaining wound care supplies, and lack of adequate glycemic control. In conclusion, most homeless individuals lack the proper knowledge and access to care that is needed to maintain and prevent diabetic foot ulcers from forming. As healthcare professionals, it is crucial for us to provide the necessary knowledge and resources for those individuals so the rate of ulcers can be reduced. Thank you.